morning.
Yeah, exactly.
Hey, the beginning.
This is great.
Do you guys feel the air conditioning?
Yeah.
Now you can stay over there. Feel the air?
I have my pointers right down there.
Yeah. I don't know. We'll figure it out if I don't know it by now. Hey, how are you? Make your way in. Do you guys want to, anybody want to be up here? Did you get your thing set up?
Yeah, I'm sorry. Yeah, I'm working on it.
You're getting it? So, stick it underneath.
I'm sorry.
No worries.
Dean, here, let us hold the bag. All right, you gentlemen here in the press, we're being kind. Wait 1 minute for her.
Is this?
I think that's hers.
Okay.
Nothing like being a showstopper. Now we need extra good reporting. How's that? Right?
Oh, I give you guys my best.
You do.
I
I'm
know.
just giving you a hard time. We're being kind and waiting for you to get set up.
You guys are.
Got it? You good? Do you have everything you need? You sure? Okay.
Yes.
Sure?
Sure. This is a press conference after all.
Yes.
It's,
Are we good? You might need this.
if you don't have your arrangements put together, then it's hard to do your job. Well, good morning and welcome. My job this morning is to just say a few words of introduction to thank the folks that have worked on this important report that we're receiving today from the Behavioral Health Consortium, to thank our Lieutenant Governor, Representative Bentz, and Senator Hansen, and all the others who've worked on this important report. You can't go any place in the state of Delaware without hearing people talk about mental health issues that are challenges in individual communities, and in particular the opioid crisis that afflicts families and communities across our state. When I was a member of Congress, we did a statewide tour talking to providers in Newcastle County, the city of Wilmington, in Kent County, and Sussex County. We talked to parents who lost loved ones. And Mary Beth, it's great to have you with us. You inspire us in the work that we're about to do. So as part of our action plan for Delaware that was put together by our transition team after I was elected governor, they recommended that we establish a Behavioral Health Consortium. And it was a group that was modeled after the Cancer Consortium, which was established in 2001. It was a group on which I had the privilege to serve as Lieutenant Governor, chaired by Bill Bowser, and it brought together experts from across the state in each of the 3 counties. It was a science-based, evidence-based effort which really targeted the resources that we had through the tobacco settlement money on important programs and initiatives that were started as part of that effort. It had very positive results in terms of reducing the incidence, in particular, of colorectal cancer in our state and mortality. And so the transition team decided that that was a good model on which to establish a consortium for mental health and substance abuse issues. The problem is maybe more serious. In fact, with the number of opioid deaths that we've experienced, I can't go into a school, and I'm in schools a couple times a week, it seems, where I don't hear from teachers and parents and others that there are trauma issues affecting the children as early as kindergarten and first grade, getting in the way of their learning. We know of the deaths as a result of the opioid epidemic in our state, over 300 last year and growing. And so the work that this consortium have done is really, really important. It's going to be our job, obviously, now, and we wanted the report to be submitted to us before the General Assembly convenes on July 1st, hopefully on July 1st, so that we can make some decisions to add additional funding to some of the funding that's already in the budget. So with that, as introduction, I would like to welcome the Lieutenant Governor Bethany Hall-Long to the podium to talk about the consortium, the process, some of the recommendations. I want to thank her in advance for her expertise and bringing that expertise to this effort and convening hundreds of people, frankly, across our state in the public meetings that you had. Tremendous good work, and we look forward to the challenges ahead.
Thank you. Thank you. Thank you very much. Appreciate that. Well, good morning to everyone. I was thinking, how can you summarize 10 months or more of work and originally 1,100 recommendations down to 117 quickly? So what I'm going to do is just to start, as our governor said, to thank him, though, first and foremost for his leadership, his commitment, and his team's vision that we needed to address this issue and taking that model from the Cancer Consortium. And I want to thank each and every one of you who are here today. Some of you are fill-ins, I know, representing some of the agencies. But what makes this happen are the experts, our families, and our community. That's what this is about. And so today, when we're done the report, we have some limited copies. We're going to be turning over to our governor a report that I don't call a report. This is an actual action plan. This is a very unique approach. This is actually from the diverse voices and community across our state. This action plan comes from over 600 Delawareans who helped us put pen to paper to come up with both short-term and long-term actions. And so you'll see that this is our initial launch pad, our launching pad to address in Delaware the behavioral health system. And that word behavioral health, as our governor indicated, is mental illness and substance use disorder. So behavioral health, again, how we might make sure that we are being comprehensive. So let me take you a little bit on the journey with the process that we embarked on, one in which did include listening to families and loved ones and persons up and down this state. And you'll hear from our director of DSAM in a minute. And I have to say, our cabinet secretaries from Education, Youth and Family Services, Homeland Security, Health and Social Services, all bought in and all recognize that this is something that we have to address. Our behavioral health system that is fractured and has significant substantial gaps. So we went up and down our state listening to families, and as all of you have heard, every one of our families addressed issues from the cradle to the grave. We were listening to persons with autism to Alzheimer's, but the elephant in the room is obviously the opioid heroin addiction, and that is our first year's major area of focus, is on addressing the addiction crisis that we face in this state. And as we listened, we all have our hearts were heavy, often, from the problems with access and to individual suffering. I think about the families and the mothers who came forward, Seaford, 3 a.m., child with a mental health crisis, didn't know where to go. Even though we have Help Is Here, we have hotlines, people are traumatized, co-occurring disorder. The grandmother here in Wilmington who pleaded for help for her child who had a substance use disorder and that she was now raising the 3-year-old and had a family cycle of prison reentry. And I look to Mary Beth, and I know Dave is here in spirit today with his son Greg. Mary Beth's son Matt came through to us with their passion, their commitment. with attack addiction, and Don with Tyler. I felt as if they were my son. I think all of us, as we listen to residents, as we brainstorm problems, they were our family. They are our family. They are Delawareans. This cuts across our school setting. This affects our workplace. We have a lot of businesses who are invested in this issue. It affects our economy and our places in our faith-based community, and so very much broad-based. And many of you know we've been working over the past year with other agencies, whether it's our Department of Justice or Attorney General and other offices, to actually begin to think about what it is Delaware can do. So I'm really excited that we have with us this roadmap that's going to launch us, project us actually forward into making some immediate changes, making some immediate recommendations. So when you get the report, you'll see we have some color-coded committees. Just like the Cancer Consortium, we went out in the community and we listened. We came up with 1,100 recommendations, whittled those down with the help of concept mapping and others. And my team, I want to give a shout out to my team, who looked like they were preparing for midterm exams some days with papers all over the room, and the work that they did. But we've whittled it down to the top 117 for years 1, 2, and 3. And as you look through the report, you're going to see the testimonials that drove us. Every meeting started with testimony from someone affected and impacted. The consortium will be looking at issues around access and treatment. We will be looking at issues with law enforcement and corrections, support. You can read the report around our committee structure. But let me attest to you that with this governor and myself, we will not let this report sit on a shelf. This is a roadmap. It's a launch pad. We're going to get things done with members of the General Assembly and those behind us to make sure families do not suffer. So let me just highlight, because again, don't want to talk too long. We have others that want to share their stories. Some of the highlights of the report. Immediate action. We need some immediate action in the areas of expansion of naloxone. Our law enforcement, our first responders are present today. Thank you for your commitment. We need to be able to expand. We also, one of the most pressing issues that we've heard consistently is the issue of expanding our continuum of care. So what does that mean? That means more detox beds, residential. That means, in addition to expansion, intensive outpatient treatment. And that includes transitional housing, AI, sober living. We must have those expanded to really address the immediate bleed of the heroin that we're experiencing on our streets. In addition, I want Delaware, with DSAM and Dr. Rattay with GPH, who's not able to be here today, we want Delaware, with our governor's leadership, to be the first in the nation to implement an overdose system of care. And I know some of our legislators are working on that now. Just like we have trauma and stroke overdose systems of care, we need, or trauma and stroke, we need that overdose system of care. And so we're excited that hopefully before we leave in June, we'll have that implemented and be the first in the country. In addition, you hear a lot about medical assisted treatment. We need that expanded, as well as working with our community with MAT, but also our corrections facilities needing an expansion of medically assisted treatment. In turn, there's a long list you'll see of other real immediates that will stop the harm. But in addition to stopping the harm, we've got to do the stigma. And I'm so delighted that you're here today, and I think each of these experts would share with you that having people willing and open to talk about mental illness and substance abuse, to not be ashamed, is step one. And so working with our education system, our workplace, and our communities, making sure people have the tools and the training, whether it's a school teacher, to a correction officer, to a faith-based leader. We need that service. And they need to know where to send people and have a 24-hour hotline, a point of entry where people can actually enter if they do come across someone who is experiencing suicidal thoughts, a mental health crisis, etc. So, again, immediate care, education, prevention, stigma reduction, and then finally, having all those support measures. You'll see a whole committee addressing support, but around support, we really know that in Delaware, we have not only 30,000 adults and 9,000 children suffering with mental illness, that our #1 provider of mental health services residential treatment is our correction system. In our correction system, we have 82% of our inmates suffer from mental health or substance use disorder. So we've got to put emphasis there and keep people out of prison. The diversion programs that we're seeing with local municipalities, county government, discussions that we're having with the state to divert individuals away from incarceration and getting them the mental health treatment that they so deserve. So, to kind of summarize, these 6 areas of focus went from 1,100 to 117, down to year 1 priorities: immediate, stopping the bleed, getting education and services to our community, to our children. I see Secretary Manning has joined us in the back. She recognizes that for children in this state, we do not have a teen detox center. We need to be looking at an assessment for education and treatment, what we're going to do with our youth for their future as well. So, I would be happy later with our other members at the end to go into a little more details. I think we have it kind of memorized, but it really is a roadmap. It's a launch pad, and I'm really hoping as all eyes around our country are watching Delaware to become a national leader in this area to address it. I'm excited, and again, I want to say thank you to the members of the consortium and to our governor for having the passion and commitment. So with that, speaking of passion and commitment, I'm delighted that we have one of, I think, the country's best passionate and committed directors of substance abuse and mental health. She brings a lot of expertise. She's been very open-minded to change, and she tells it like it is, and she recognizes when we need to make improvements. So with that, I'm going to turn it over to Elizabeth Romero, our Director of DSAM. Elizabeth, got it?
Thank you, Governor Carney and Lieutenant Governor Hall-Long, as well as all the leaders and partners here on the Behavioral Health Consortium. This report and recommendations are an important guide to begin comprehensively addressing our state's behavioral health needs. As Delaware strives to implement a healthcare spending benchmark that will help us understand how our healthcare dollars are being spent, understanding and addressing our behavioral health needs are a critical component. While half of Americans will have a mental health illness at some point in their lives, those with behavioral health needs and a chronic disease can cost 2 to 3 times more to treat for that chronic condition. As a nation, we are all aware our opioid and addiction crisis in 2017 cost us $115 billion alone. Therefore, the consortium's efforts to create a plan to prevent, treat, and support those with behavioral health needs will begin our journey towards a comprehensive approach. This summer, with our partners, we will be launching our adoption of the Centers of Excellence model to improve our substance use system of care, and to improve our, as highlighted as a need in the Behavioral Health Consortium report, we have a strong focus on peer support, navigation, and to ensure that no one gets lost, and high-quality evidence-based treatment with wraparound supports. However, most importantly, as the Lieutenant Governor highlighted, and as we've toured the state and I've heard on many cell phone calls, our families and individuals are exhausted. They're exhausted and they're tired. They've been trying so hard to fight for their loved one, to fight for themselves, to get access to treatment, to get access to mental health services, and we need to do better. This consortium roadmap will be an important part to help us get moving, and we cannot stop because we have to help and engage those who are also afraid to come forward. So thank you all for this. Thank you for the attention focused on behavioral health needs. I think across the country, this is one area where Delaware is really taking a leadership role. And with that, I'm really excited to also show our partnerships with the Departments of Education and the Christiana School District and introduce Michelle Marinucci. Michelle.
Thank you. Thank you. So I'm absolutely honored to be able to be here today and to be part of this consortium, so thank you so much. The work that we have been doing has been incredible. This has been a process that I have been just so intrigued by and impressed by. We've had a myriad of people from all kinds of backgrounds come together and sit around the table, having the conversations, and some very difficult conversations, sharing information that's sensitive and personal. and all to work toward the solutions and improvements of behavioral health in Delaware. Essentially, we're looking to save lives and make a massive impact to counteract the challenges of both the opioid epidemic and trauma and adversity that so many in Delaware and across our nation are facing. Over the past few months, we've come together as a consortium, and then we spread out across our state holding community forums. Through these forums, we were able to truly listen to the people. From the judges, the legislators, the grandparents raising their grandchildren, recovering addicts, people struggling with mental health needs, nurses, educators, and more. We've sat around the table and we've had conversations. Those conversations, I can tell you, have had a profound effect on me, as well as the other members of the consortium. And I've continued to reflect on the messages and what I've heard from people, those of hope and those of need for more supports to be in place, and equally importantly, the need for prevention and early intervention. So from those conversations, as well as from the survey that was available, we were able to gather huge amounts of input that were then put into a much more focused and usable report. From my perspective as a district leader, this has the potential to be the most meaningful task of my career and all of ours. To be able to incorporate more proactive and powerful changes that we can implement to truly reach our students, to reduce the high number of children entering into our schools who have had exposure to behavioral health issues, either through their own personal experiences or through those they have viewed, their family, their friends, their community, and to truly make a difference. So with that, I have the distinct honor of introducing Senator Hansen.
Thank you. It's been a long journey. It's just now beginning. I've been very proud and anxious to be a part of the Behavioral Health Consortium. The work they've done, that we've done, reaching out to members throughout our entire state, the residents in our entire state, parents, educators, folks in the recovery community has been phenomenal. And there's been a lot of work put into the roadmap, and we're very proud to be able to introduce this today. And I'm proud to be in here. I'm proud and honored to be here today as part of the team with the Lieutenant Governor and professionals in the mental health field and advocates and so many others that have spent a lot of time listening to our citizens and thinking deeply in developing our blueprint or roadmap for going forward to address the public health crisis that we have. In 2017, there were 345 overdose fatalities in Delaware. 11,429 arrests. The number of Narcan patients increased to 1,905, with the youngest patients being toddlers and the oldest over 100 years old. There were 13,638 admissions of substance abuse clients throughout our states. The crisis has gotten to the point where it affects all of us every day in ways that most of us aren't even aware. Perhaps you've been a victim of crime where your car has been broken into or items stolen from your garage by a person needing money to feed their habit. Perhaps you were late to work because there was an accident on your route caused by an impaired driver, or you were passed by an ambulance on its way to the hospital transporting another overdose victim. It's taking longer to get repair work done at your home or construct your new home because contractors can't find enough workers to pass a drug test. Your health insurance costs are going up because we all pay for the increased cost of health care treating the effects of substance abuse disorder. It takes you all morning at the police station or the courthouse, which is now packed with people, in order to file simple papers because our criminal justice system is being overwhelmed with drug-related matters. Or maybe yours is one of the growing number of families that is paying every day in anguish and family turmoil, living with a loved one struggling with addiction, or more often, now living with grief. This report is our blueprint, and it's our best shot to get our arms around this monster. It's going to take a coordinated approach, and with our legislative colleagues and intense focus, I applaud our Lieutenant Governor for her sustained and informed approach, and I look forward to working harder and longer every day on this issue. It's personal. It's personal with me, it's personal with every member of our General Assembly and every member of the consortium. It's personal, but we recognize the value and the necessity of a team approach. Thank you very much. And I now have the opportunity and great pleasure to introduce my colleague, Representative David Bentz.
Good morning, everyone. I've had the opportunity to see a number of these sorts of, whether you want to call them task forces, working groups, consortiums, do work in the past. And this one has been by far the most engaged and enthusiastic among its membership that I've had the chance to see. And I think the report that's being released today really demonstrates that. What was the number again? 117? 117 recommendations. This isn't, 10 bullet points on how to move forward. This is a broad, comprehensive path forward that I'm very excited about because, as you'll see with the time frames put on these, a lot of these are things that we can do very quickly. In fact, the Lieutenant Governor touched on the overdose system of care, which is legislation that I'm going to be sponsoring in the House that we hope to have introduced before we return in June. And we're going to give it all we have to get that thing passed by the end of session. This is obviously, as has been stated by other folks, this isn't something that's just going to sit on a shelf. As evidenced by all these action items, as evidenced by the enthusiasm. I know our Lieutenant Governor, if anyone's had a chance to work with her, we know she won't let that happen. We know the Governor won't let that happen, and then most of all, I think all these advocates who have been involved in the consortium and working so hard won't let that happen either. We have an opportunity here, as outlined in this first report, to really take fast, quick steps forward to really help the families who have been affected by addiction and the individuals dealing with addiction themselves. So I'm very excited about the path we're setting here today, and I look forward to continuing the hard work with all these dedicated individuals. And I'm going to bring back up Governor Carney to finish this off.
So, lastly, I want to thank everybody in the room who's been part of this effort. I want to thank the Lieutenant Governor again for her leadership of the consortium. I want to thank my transition team for recommending it in the first instance. I want to thank our legislative leaders who are going to be with us as we try to implement the recommendations here. I think the key takeaway point is this is just not a report. This is really an action plan. And our job now is to prioritize those action items and to get to work. And as Representative Bentz said, he's confident that here in Delaware we have the will and the wherewithal to do exactly that with the folks that have been involved in the consortium, with members of the public for whom this is a huge issue, and it should be for all of us, as whether you're talking about mental health challenges and trauma in elementary school, whether you're talking about the need for substance abuse and mental health treatment for those who are incarcerated, or where you're talking about the terrible scourge of the opioid epidemic in our state. This plan, this 3-year plan, it's also important to point out, is an action plan, and it sets forth those action items that we should entertain right away. There's been mention about the continuum and the system of care and access to effective treatment and services. Those are things that need to be developed. Oftentimes they don't come about overnight. And so this is going to be a long-term commitment, initially, as the Lieutenant Governor said, to stop the bleeding, and then to put in place a system that deals with this terrible scourge across our state. We know that there's a huge cost. Elizabeth Romero mentioned that in her comments. I think she said $100 billion nationally. There's no price that you can put on the loss of a loved one. And really that's the motivation that needs to be with us there as we implement this action plan. So again, thank you to the Lieutenant Governor, thank you to all the advocates, thank you to the members of the General Assembly for their efforts, and we look forward to getting to work. And with that, if there are any questions, we'll try to answer those.
Governor, you mentioned that there's obviously costs associated with this. I know the report does not dollar amounts with this? I mean, do you guys anticipate being able to actually fund a lot of these initiatives?
Yeah, one of the things that that I talked to the Lieutenant Governor about as she was leading this effort was that we needed to have the recommendations prior to the June markup. Well, we're just about into the June markup, so we have the recommendations. The key will be to sort out those priorities and those items that cost money that can be done immediately. We already have on the treatment side over $20 million in the budget with the existing treatment services, but we need to build on that. There are a number of other things. Representative Bentz mentioned his legislation with respect to the system of care. All those things need to be built and funded as we do that. The key and the challenge, I think, will be to prioritize the items, what comes first, what's most important, and I think the consortium, when you start with 1,000 recommendations and you pare it down to 100, and you got to pare that down to the things that are most important. My guess is there was considerable debate and discussion about what's most important. I know that's a fact. And so there'll be a similar discussion and debate about that as we work with our friends in the General Assembly about that. And we expect, my message to everybody will be let the science, let the experts drive that discussion and that debate.
There's a lot of people with addiction that also have co-occurring disorders. Can you talk about what recommendations surrounding co-occurring?
Sure. I can give it a shot, and then I would love it. We have so many awesome experts here, NAMI and Dr. Thomas and others if they want to jump in, and Dr. Ellison and anyone. Co-occurring is the major concern that we have for those who are not familiar, meaning substance use disorder with a mental health illness. And you will see in both access to treatment, you will see in our family support line, as well as in our corrections, because in corrections, Governor Carney, having chaired the Board of Pardons, and myself as Lieutenant Governor when he was in that role, most of the people we see coming forward had a co-occurring disorder as a juvenile that ended up in our correction system. You will see that lumped together. So in this report, please understand that it's an umbrella, and it does encompass both co-occurring mental health and substance use. And there is a vision that once we stop the bleed, address the opioid heroin addiction issues, long-term strategy, even more focused with the mental illness side, which addresses brain disease, which then addresses issues like autism, and Dr. James Ellison, who's the expert here in aging and Alzheimer's. So we have a long plan that will lump mental health and substance use together. And if I missed anything, guys, don't be quiet. They're not usually quiet. They're very engaged. Anyone? Did you want to add, Dr. Thomas?
We have lots of cameras on us. That's
Yeah.
why we're quiet.
Okay, yeah. Say who you are.
I'm Josh Thomas. I work with the National Alliance on Mental Illness in Delaware. And what I think is really important in this discussion is the level of stigma associated with mental illness and addiction. And it's one of the reasons why people with mental health issues are more prone to addiction. There's so many people that have those co-occurring disorders, and it's because seeking treatment for those illnesses is problematic for them. They're afraid to step forward and say they have a mental health issue, and as a result, they might be more prone to self-medicate through the use of drugs.
Thank you.
Other questions? Seeing none, thank you very much. And again, thank you to all the folks that are here.
Thank you. Yep. Thank you. Thank you. Thank you.